Hi, everyone, and welcome to special simulcast, the Neil Haley Show and the Ultimate Men's Movement with our host, Dr. Jack Rocco. Dr. Jack, how are you? I know
I'm,
you have a topic today. You're on location, aren't you?
we do, Neil. We've had a fantastic week. We spent the first part of the week, Monday, Tuesday, Wednesday, in Charlotte, North Carolina, learning to do and getting some volume in with Dr. Loria's procedure. And then I had the pleasure or curse of meeting him. We've had a great week.
Tell you more details about that later.
Yeah, the police, but anyways, we've been working hard, learning a lot. I think when you come down here, my initial impression was, what am I getting myself into? I'm going to Miami Beach to work with a guy who works on primarily penile enhancement. And what exactly am I getting myself into here? And we've met before, so I did have an idea. But the science behind it, and we've spent a week of just nerding out with the microenvironment, the chemistry, and I'll let him go into this because he invented a product. He's got patents on a product which inserts and we inject small little silicone particles which create an inflammatory reaction in the skin, which your body will engulf and then go on to form permanent collagen formation, which as opposed to Juvederm or some of those Hyaluronic fillers, this will stay permanent. So I'm going to introduce Dr. Loria and let him go into more of the details as to what he did and what we're doing. But this is what we're going to be bringing as one of our core products and our core services at the Ultimate Men's Clinic in New Bedford, Massachusetts. So it's going to be a big part of the services we offer. Go ahead, Victor.
Go
Take it away.
ahead.
I think Dr. Rocco's ready to hit the ground running. So that's a good thing. And I think it's a great service add-on to what he's doing because that completes kind of the circle of things that men need. What do men want? They want to be healthier. They want hair, and hopefully you'll do that too. We'll talk about that later. And also a larger member. That's just the bottom line and so forth. I think it should be mandatory after high school to get it. It would be a big hit, I think. But the process is simple. I want guys to know that we provide a service that's for enlargement is non-surgical. That's very attractive. It's just injection of filler, right? But it's permanent filler. That's a big difference. Like Dr. Rocco said, there's hyaluronic acids out there, Juvederms, et cetera, that work, but are temporary and cost prohibitive. Okay, so you have to do it every year. Now, if men knew about that, if that's the only choice, that's fine. But when they find someone like me, now Dr. Rocco, who has a permanent solution, that's attractive. Okay, now it becomes economical and feasible for them to do this. And how it works is this, it's very simple. In 2010, I developed this formula that has an active ingredient of silicone oil. Now, silicone oil does not work very well by itself. It has to be put in a special formulation, a special mix for it to work. So when I do this mixture and inject it, the body reacts with it and there's collagen formation. This is something that we're exploiting. We want this collagen formation. We want the body to do this, to build collagen. That's the permanent element of this. And that's how we build girth. And girth, I say, is king. Okay. Length is good, but girth is critical for sexual stimulation, period. Okay. So the process is you inject the filler, you generate collagen, you generate girth, and that girth stays there for decades. And of course, you do one, two, or three treatments to achieve the girth size you want. I usually recommend about 7 inches in circumference. That is, to me, would be near optimal stimulation for just about any female out there. Okay. And that's what we recommend for patients and so forth. Any questions so far about that?
No,
No,
not at
I'm
all. No, I just, I mean, who do you see that's doing this, especially in your practice?
Who's doing my procedure?
Yeah.
I've trained a few doctors. They're out there in the United States. So there's a half a dozen or so that are doing this
I think
procedure.
you're referring more to the patients
The,
who are
the
coming in.
patient, the patient, the patient.
Yeah,
Yes.
Oh, okay. I've had patients as far as Singapore from all over. I just had a patient. It was funny. Just I got an email from a patient from Kosovo that said, "Hey, I'm happy." He was a micro. He was a micro penis, about 4 inches in erect length, very narrow. Okay, and he is tickled pink. You can imagine how that changes your life. Being a micro to now he's normal girth in one procedure. He's going to come back 2 more times to advance that. But most of my patients are from U.S. and Canada. So that's where most of my patients.
Now, what do you think about as far as married versus single, straight versus gay? Do you have any statistics on that?
A little history about me. I'm a religious guy. Okay. So for me, I was in the beginning, I wasn't going to treat unmarried people because when a young guy gets a bigger member, promiscuity isn't my thing. I'm not looking to promote that, honestly. Okay. I'm looking to get to the married guy and make his marriage great. Maybe it's good, but it can be great in the bedroom if there's some extra girth involved, right? Now, I'm okay. The reason why I just treat everybody is because I had a young kid come in and he was a micro. How can I not treat him? I had to because he wanted to jump off a bridge, this guy.
Yeah.
Okay.
The psychological aspects of it, and we talked about this a lot. Men, young boys in the shower, high school, middle
It's
school.
devastating. It's
Yeah.
devastating. It's just the nature of it. Okay. But there is a solution. That's the thing. A lot of guys don't know. And we want to get the word out that, hey, we have a decent solution here. We can get you girthy. And we have techniques on length. We'll maybe talk about that on another show, perhaps. But there is a solution or a good remedy for this situation. Period.
It's interesting when you talk about it, specifically when you're talking about girth. Explain how guys even know if they have not the average length of the right girth.
The average girth is around 4.75 inches to 5, right? The vaginal space, it could accommodate much more than that. Okay. The stimulation factor is not very good with an average size male member. Okay. So to stimulate the walls of the vaginal space, 7 inches is what you're going to need. Now, how do I know this, right? I'm just picking out a number. No, I'm doing this for 15 years. I must have done 11,000 procedures. I've interviewed thousands of my patients, and I tell them, how did it feel after the first treatment? Oh, it was good. How did it feel after the second one? Because after the second one, they're approaching that 7 inch mark. And now I'm hearing, wow, it used to take me 20 minutes for her to orgasm. Now she's orgasming in 60 seconds. These are real numbers. These are real time frames, by the way. 60 seconds, and that's real. Okay. But because of the intense stimulation of the vaginal walls, because as I explain in my videos, I have a lot of videos, the clitoral nerves actually branch within the walls of the vaginal space, right? So if you're entering the vaginal space and stimulating all the walls, it's like almost having oral sex with your penis in a sense, if you think about it. That's how stimulatory it is. And that's exactly what happens. A lot of good reports, a lot of good results, a lot of happy people.
So
Yeah,
how do people know if they're average or not average and when they think of length versus girth?
average length is probably 5.5.
Right.
Right, that's average.
Yeah.
Average girth, 4 3/4 to 5. That's average.
Yeah, I
Okay.
think if you take one of those tape measures for a
Yeah.
tailor, and basically it's the mid portion, you do a circumference at the mid portion, that'll give you your average. There's diversity amongst people. So there's really no standard per se, but how much would you say how much would you say one treatment would improve the girth from 4 to
Probably say about an inch.
so with the that if someone is a 4 or 5, one treatment will get them an extra inch and a
Yeah,
second
We
treatment.
have a good model right here. See,
Oh, here we go.
this is what we're talking about. See, this is a pretty good size. Okay. I'm serious. This is
Yeah.
about 7 inches, actually. This is 7 inches in girth. It might look very large, but remember, a baby has to go through the vaginal canal, right? So there is stretchability there, especially those who have given birth naturally. They have a little extra stretchability and they can certainly handle it. They can. I have patients that are 9.5, 10 inches in girth that their wives love, but not for everybody. Now, that's a little different now. That's kind of very big. But sometimes you have to customize for your spouse. And that's what we do. The patient says, hey, I'm at 8. There's still room in there, they say. So we go to 9. And if 9 fits, that's perfect for them. And that's what we do.
Interesting. Okay. So that was something interesting to look at. That's the girth. That's 8 inches girth. What you
Well,
just
this
showed.
here, if I look at this coconut water bottle, it's a 7. This is
Yeah.
a 7. And,
What'd you
okay.
say?
Of course, this I think is the perfect size for the male member. Okay. This is a perfect girth. Okay. And I know this, again, I know this because of experience. I ask my patients, how does your wife like this or your girlfriend, whatever? Even my gay patients, that's a good size for them too, and so forth. The gay population is a little different. They're a little more finicky when it comes to the male member, right? It's more of a priority to them. And I ask them all the time, and they tell me, no, this is important for us, and so forth. And that's just the way it is, and that's fine.
Yeah. The
Uh,
conversations are very open and very honest that we're having with the patients. And it is a personal thing.
Oh boy.
Yeah.
Oh yeah.
And but the great thing that I've really loved about it is that the complications are so few. Perhaps some local skin irritation. Go on, maybe talk about
The key
what you've
is,
seen.
I always tell my patients, this is cosmetic, and we try to balance it out and proportion it. Now, we fill the penile shaft and glands, for example. If we fill this the shaft and here's the glands, we'll fill as much as we can evenly, right? We want to parallel the anatomy that we have. And usually we're pretty close, okay? But I always tell patients, if you're a perfectionist, don't do it because you might have a little concavity here or some sort of mild indentation here. Do most guys care? No, they don't. But the perfectionist will care. Okay. And it's hard to be super perfect. Okay. Even though we try, trust me, I'm very particular about how I inject, how much I inject, where I inject, and all this kind of stuff. So I want it as perfect as possible. But there's one issue. The penis is a moving target, right? So it erects and it contracts in flaccid state. The problem is when it contracts, it can distort a little bit, right? Now, a normal penis, right? A normal penis, when it retracts, the skin folds like an accordion, so it's not a problem. But now that we put filler in there, it can't retract that much anymore because the skin is
Right.
thicker. So it might have a little bulge here, a little asymmetry there. So in that case, like for example, we had a case today. He had an 8-inch girth, 8.5-inch girth. To me, it was perfect. I thought he looked phenomenal. Okay. But what did he say? He says, I think it's maybe a little too big for me. So we reduced it. We could actually reverse it too. And that's good to know and so forth. But he was particular about his flaccid look. And that's what we have the least control of, flaccid, because flaccid has a mind of its own. It retracts, right? So if there's a high retraction force, there's more distortion. That's why I tell patients, I say, look, the erection has to look right. That's your functional, the money shot I call it. That has to look right. But the flaccid we have less control of because it's going to track. Some people could contract more than others. The patient I had today didn't really contract a lot, which was good. Because I said to him, look, we're going to reduce you down. And he wants to look good flaccid and erect. I said, all depends on your flaccid pull and so forth. So his wasn't high. Okay. So he looked pretty good.
Yeah, and his
actually.
concern was he said he and his wife they would travel and they would go to places where there were nude beaches. And
That's right.
he didn't like that he looked too big flaccid. He wanted to
It
look
was
a
big.
little more normal
That's right.
flaccid. And I said, and it was a great repair. It was a great way to reduce it. We took a little wedge out of the center part. Dr. Loria took a little wedge and then reclosed it. So it did look fantastic afterwards. Much
Yeah.
improved.
So he actually overshot. I mean, I just delivered the medicine,
I think
right?
he
So
had 3 shots, correct?
yes,
He had 3 shots to
three
begin with.
treatments. Yeah.
And the third one was probably a little too much for him, which is why he asked for the reduction today.
But that's unusual.
Yeah.
To ask for a reduction is not the norm. I may maybe reduce 1 out of every 500 patients. That's how infrequent it is. And that's because they have overestimated. Plus, he's a little different, this patient, because he has an open marriage. So maybe he ran into a few women he couldn't fit into, and that was an issue. He didn't say it exactly, but I figured that was the case when he said that about this open marriage thing or whatever. So I have a feeling he had a problem entering because you can't. Oh, when you go over 8 inches, you have to be a little careful the size you're asking for because sometimes you're not going to be able to park that car in the parking spot there. It's just not going to happen. And I think that was one of his issues and so forth. His
All right.
lifestyle.
So what are the costs for something like this?
In my clinic, what I do is I try to, just let patients know that they need more than one treatment. And if they do that and they buy these promotional packages, 2 or 3 procedures, the price drops. Okay. So for example, usually 2 treatments in my clinic is going to be about 15,000. Okay. Sounds like a lot, but let me say something. It's permanent. As opposed to having, let's say, a hyaluronic acid Juvederm, for 2 treatments, you'll pay 14,000 and you'll have to do that every year. See, that's the value in the permanent side. Okay. So it's worth every penny. It's a phenomenal investment. I tell the young kids, I say, forget the car, get the male enhancement done. Okay. Because that's the most important. You can always get a car, but when you get this enlargement, it's going to stay with you. Okay. And it's going to make that impact. I don't really push the young kids, the married people. I like to push the married couples. You know what I'm saying? So anyway, so it's going to cost usually if you do the 2 treatments in my clinic, it's just about 15,000 and so forth. but it's long term. You see.
And we also talked a lot about, because there's a number of uncircumcised patients that we ran into. And typically, Dr. Loria prefers to do a circumcision prior to doing any enhancement, because with the extra skin, it can lead to complications and
There's a risk.
there's
You know,
some
that's
risks there. So he does usually encourage circumcision. So he'll make packages where for one treatment of the shaft and glands, along with a circumcision, maybe around 10,000, 13,000.
well,
So
if someone's not circumcised, what we'll do is a circumcision and shaft supplement filler, and then they'll come back for a second treatment, full shaft, full glands for that same price. So we could take care of them, get that loose, thin foreskin out of the way because it's problematic, causes issues, and then give them ultimately their two treatments to get their results for it. So it works very well. Works very well for them.
yeah, and it's something that's becoming more and more popular across the country. Would you say you're not the only person doing this? This is not just.
This has been around for a while, actually. All of the different techniques, though, and most of them were surgical years ago. Now that we have injection treatment, a lot more men would consider doing it. But the problem is also awareness. I don't think not a lot of guys still know about this. They don't think it's a thing. They say, I didn't know I could do that. Did you know? Who knew?
Yeah, it's coming out more and more on social media, but you're right, for sure. And so where is the best place people we got to go to Dr. Jack now, for sure. Unless you're in Miami, go to your website. What is your website?
LoriaMedical.com.
Okay. And then
Yeah, and the product that he uses is also usable in a lot of other, we talked about this week as well, for BBLs, for instance. The same silicone product is something that we can use. And I've spent the last 2 years doing liposuction, tummy tucks. And so then this may be something that we're going to branch into to be able, or there's men with the conditions called pectus excavatum. It's like a caved in chest. It's a congenital. Dr. Loria has treated guys with that filler. Some musculoskeletal, if you got a biceps rupture or a pec rupture, and you've got a little asymmetry in your musculoskeletal, this product can also be used to fill those physical defects, physical caverns
fantastic.
they have in the body. So there's a lot of different opportunities, and the fact that what is the size of the silicone particles that?
They range between 20 microns and 100 microns.
Okay.
Yeah, and at that size, your body's able to quickly encapsulate it, and then it's walled off. It's walled in collagen, so it can't cause any damage to other areas.
All right. Fantastic. Best play for Ultimate Men's.
Yeah, the Ultimate Men.
The Ultimate Men's.
Ultimate Men
Ultimate.com.
in New Bedford, Massachusetts.
All right.
And that's also our website. And today our conversation was about cosmetics, but we also deal in function as well. So combining the function and the structure and the cosmetics. So Dr. Loria has added a tremendous asset to the Ultimate Men's Clinic's armamentarium. There's the word for the day.
All right. That was the special simulcast of the Neil Haley Show and the Ultimate Men's Movement, guys. Take care.